Hi, and welcome to our Friday webinar. We're at Ask the Vet with Dr. Tom Tully. Hello, Dr. Tully.
Well,
Welcome.
how you doing, Laura? And
Good.
I want to say greetings to all of our webinar attendees today, and find out some new and learn together again on this webinar. So excited about that and ready to get going.
All right, it's funny. I could see the participant numbers ticking up as we're talking. It's like a little ding, ding, ding. We're trending up. That's good.
Yeah. Well.
So let's see. So just for, I'm sure if you've been on with the webinars before with us, that if you have a question, to use the Q&A button instead of the chat feature. So do us that favor, use the Q&A button so we can capture the question easier. And let's see, while we are waiting for people we're getting people logging on as I speak. Dr. Tully, there's the big news about the avian flu, and was hoping that you could walk us through that a little bit on, how does it pertain to the birds outside our homes? How does it pertain to our own pet birds and all of that good stuff, or not good stuff, but what we should be aware of is we're going to.
Well, one of the, I guess, when we're talking about avian influenza, I think people will recognize that avian influenza has been in the news for many years now. Avian influenza is a virus that is endemic, meaning that it's within the United States. And there were concerns, as everybody can remember, maybe not everybody, but some people can remember, probably about 5, 10, 15 years ago, and at different time points, where there was a concern about variants of this avian influenza that would become zoonotic and transfer from birds to humans. We have been fortunate that has not occurred, but this virus is within the population of birds, as I said, even worldwide and within the United States. So this isn't a new virus. However, there are, and it continually changes and mutates, just like you've heard about the coronavirus mutating from this variant to that variant. Well, that's what the avian influenza virus does. And as it goes through, that some of these avian influenza viruses are not that severe, or what they call pathogenic. And so they're mild and really do not cause significant disease and death to the birds. And sometimes some of these variants affects specific species. Of course, the USDA is always concerned about all of the birds, but of course they're really concerned about any variant that affects the $35 to $45 billion poultry industry. And I give that range because it goes up and down as far as each year, but it is in that range. And so they want to protect the poultry industry as much as possible, and also other birds, but that's kind of a primary focus, as you could well imagine. With that said, and as I mentioned, there can be variants that are that really affect waterfowl or rheas, for instance, or ratite, but not really, it's not pathogenic to poultry. So that's not on the map. Now, the current strain or variant of avian influenza is called H5N1. And that is how they identify it. There's surface proteins on this virus, and this is getting a little complicated, I think. for just, but that's how the surface proteins, they can identify those. And it's H5N1. And in North America, they started seeing this probably in December of 2021. And then it's been confirmed in wild birds, backyard flocks, and commercial poultry. And it is highly pathogenic, meaning it causes disease and death. And so through the government, they track this. And so where is the confirmed cases that they have at this point? And the map is updated weekly. And so really the highest concentration is in the Iowa, really Minnesota, southern Minnesota. You wouldn't expect maybe, but northern, but it's southern Minnesota, eastern South Dakota, kind of North Dakota, but it spreads out. You have some identified areas in the upper Intermountain west, from Colorado up to Wyoming, into Alberta, into Canada, and then across the Midwest, Illinois, Indiana, Wisconsin, southern Michigan, into the Northeast, into New York, New Hampshire, Vermont, and into really Massachusetts, Connecticut, and down the East Coast into Florida, and some spots in South Carolina, northern Alabama. But really, as I said, the main concentration is in that area, southern Minnesota. Really, you're looking at western Iowa, Nebraska, and South Dakota, North Dakota area. But all of those areas that I mentioned is where it's at. So should people be concerned? It doesn't, CDC says it doesn't represent an immediate public health hazard. No human cases have been identified. You just still want to protect that there is, yourself as much as possible. I think at this time, if I'm correct, Laura, that they're not recommending having bird feeders at this time, outdoor bird feeders, to try to diminish the spread through wild birds. And as I mentioned, it is highly for poultry. If you have backyard chickens, this is a concern. And you say, well, what kind of signs could it be? They say really with highly pathogenic avian influenza, you usually have respiratory signs, as you can imagine, digestive, like diarrhea, and rapid death. So it's almost, it's really quick, this highly pathogenic as far as death. If you have birds that are gasping for air, you see that we're fine. Then gasping for air, then have some kind of a pasty vent, dirty vent, and then die, then that would be of a concern, especially in the areas that I've mentioned. They may have some swelling around the head, neck, and eyes, and have purple discoloration in the head and legs. And the purple discoloration is just due to the lack of oxygen. They have respiratory disease, so their blood isn't oxygenated. So therefore, you're going to have a kind of a purple discoloration. Other poultry species, including turkeys, may have some nervous symptoms or signs. Birds don't have symptoms, they have clinical signs. Tremors, and so they may have paralyzed wings and laying down, pedaling, but pretty much rapid death. So you say, well, how can I can kind of reduce the chance of the birds having this coming in contact? And you may hear some banging. They're actually working on the building to make sure.
You're not someone locked somewhere.
Yeah, exactly. The best way to keep your flock healthy is separate the flock from disease sources, including wildlife and wild birds. So separate, if, at least try to do something now until this will pass. But if you can do something temporarily, that's going to be very helpful. Keep all of your poultry area and equipment clean. Separate new or returning birds from your flock for at least 30 days, and don't share equipment between neighbors with other birds. Again, highly transmissible and highly pathogenic. So that's kind of it in a nutshell. Now people go, well, what about parrots? Now, parrots are birds and are also susceptible to avian influenza. However, there may have been a parrot or something similar that is has had the new pathogenic variant of the avian influenza virus, but I'm not aware of it. And I've tried to locate something on the internet, and I have not found anything. And but I would say just be cautious, and with most birds inside. But again, some of the birds are outside. But many times within the cages, as opposed to if you have a backyard poultry area that's open, there may be more exposure to wild birds, but you want to try to at least at this point reduce that exposure as much as possible. But I haven't heard of any having any issues, but that's kind of a rundown in a nutshell.
Okay. Maybe we can at some point either maybe even like, I know the other contagious disease would be Newcastle, which we have outbreaks of that in the past and such. Is that kind of similar or more pertinent to parrots and pet birds? Just curious.
No, not necessarily. Newcastle, and that's paramyxovirus, exotic Newcastle disease, velogenic viscerotrophic Newcastle disease. What the difference between that and avian influenza is that paramyxovirus, exotic Newcastle disease, the United States, now other parts of the world, and I know we have webinar attendees from all over the world. This is endemic in those countries, but in the United States, that is the United States is a exotic Newcastle disease free country. Okay, so that is a certification in that the USDA and it tries to maintain USDA and probably the USGS, and these are just governmental agencies, and in the poultry industry try to maintain this country Newcastle disease free. And so if there are outbreaks, which there are, and then particularly in the last 20 to 25 years in Southern California or Southwest US. And this is and so they do everything to eradicate this virus, so that they can so it does not get out into the general avian population, and it's not transmitted by wild birds to a significant degree. Avian influenza, however, is transmitted by wild birds to a significant degree through migration and it's within the all over the world, and even in the United States. So that's the difference. Newcastle disease, we're disease free here in the United States, but with avian influenza, we're not, and they're a country, and so that's the main difference here with those two. And also avian influenza, whereas exotic Newcastle disease, every time it'll kill parrots, it'll be easily transmitted, boom, all the time. Avian influenza, this variant may, this variant may not. This variant may, this variant may not. And I think that there was one bird that was written, there was an article that at Davis, they identified with one of the variants of avian influenza about 10 years ago. That was concerning. So parrots do get it, but it is not this was a paper that was published. So that's how unusual it was.
Oh, wow.
So does that make sense to you?
Yeah,
Newcastle
no, that was
were
fascinating.
free, and it always is pathogenic to parrots, backyard poultry. That's usually how it comes in, through illegal fighting birds. That's how it usually comes in.
Wow. Okay, that's fascinating. That's an interesting distinction.
Yeah.
Thank you for walking us through that, and then hopefully we'll have better news if we revisit the avian influenza. Maybe it'll pass sooner than later.
Yeah, basically people can do things to keep their birds to reduce exposure and it will pass. But then again, 3 years from now, we'll talk about a new strain. I mean, that's how avian influenza works. And yeah.
All right. Well, let's see. I have some questions to throw at you from let's see, some of our viewers wanted. So the first one is, they say, I'd like to take my Amazon outside in her travel cage to get some sunshine, but they're worried about the avian flu. Is there any possibility of infection when she's just in her cage and not in direct contact with birds, feeders, bird baths, etc.? So that's a good segue question from what we just discussed.
Yeah. You have probably very little chance. I'll never say no chance, but it would be very little chance that there would be exposure within the cage outside like that. Yeah.
Okay. And then Ellen has a 22-year-old African gray that was just diagnosed with second-degree AV block at his annual physical. During the testing, his rhythm occasionally normalized, so they feel it's vaginally mediated. He is I think they meant asymptomatic, so we are told to do a recheck in 6 months. Is there any lifestyle behavioral or dietary changes that can be made to help him?
No, it's not a not a real, not a, I would say a bad diagnosis. I would say that it's something that the bird can accommodate to, and that just monitoring the bird, as the veterinarian had mentioned, is good. No lifestyle changes. I think that's that you've done well. How old was the bird?
22, an African gray. And just
doing well.
Sorry, what an AV block? Just real quick, what is that exactly?
It probably it goes into causes an arrhythmia or irregularity in the heartbeat. So again, many of these are the bird can accommodate with that. And so it just it causes AV as atrial ventricular, and so the atrial is the top part, ventricle is the bottom part of the heart, and so kind of a communication between that. And so there's different degrees of severity between the kind of the communication issue to, and then it can can be some more severe, but I think they said this was a second degree, which is kind of lower on the scale. And so again, like I said, the bird can accommodate to that, and there's just a little bit of irregular rhythm that can come and go, but anyway, yeah, I think that as far as lifestyle, no changes really, but as far as nutrition, I'll always just maintain them on a very good diet, and that's going to again, whether it has this or doesn't, it's going to have a lot to do with the bird being able to survive and live a long, healthy, happy life. So good nutrition for sure.
Okay, so good nutrition. That's one lifestyle that you can have better control over it.
Yeah.
Okay, and then Jane recently lost a bird to cutaneous lymphoma. Right? Is this a common cancer in birds?
No, it is not. You know, you're going. That's a very good question, as usual. And so you go and you think, well, what are common cancers in birds? Well, birds do get lymphoma, leukemias, but we don't see it in the cutaneous is like especially involving the cutaneous skin, but and then it could be kind of a lymphoma can also disseminate or involve other parts of the body, although in this instance it's identified through its interactions through the skin, but it can also be involve other parts of the body. And it is not a common, we do not see it commonly, but we do see it. And I'm just trying to think off the top of my head what some of the more common tumors or common cancers that we see in birds. We see quite a bit of squamous cell carcinomas in birds, and then of course we see a number of what we say gonadal, ovarian, and testicular tumors. We see those, and we see those in budgies. And then others you call lipomas, fatty tumors. We see those quite a bit, especially in certain cockatoos and parrots, and especially those that are somewhat overconditioned, if you say, a little bit heavier than they should be, that we see those. But pretty much birds in general and our parrots are susceptible to just about every tumor that that they have anatomy for. So for the most part, there have been these tumors and cancers identified in birds, and so but they're relatively uncommon, just like this cutaneous lymphoma.
Okay. The next question is from Sandy. Has three of the flock of 7 have possible chlamydiosis? The 3 are 1 doxy so far. What else should I do for treatment? And should they take a prebiotic? So let's see how I killed those words. If you could.
Let's see.
Sorry.
So there's 3 birds.
3 birds,
Three
yes, out of 7. Got that.
out of 7. And what kind of birds are these? Do we know?
No.
Okay, so
Let's see
3
if Sandy can
birds.
ping us and let us know what birds.
Okay, 3 birds out of 7 have been diagnosed with avian
Possible.
possible
Possible.
avian chlamydiosis, and her question is, they're being treated with doxycycline.
Yes, and they want to know what else to do for treatment, and they also take a prebiotic.
Okay, or a probiotic, I guess, is what she means, which would help with the microbiome within the intestinal tract, something like Benebac or something of that nature. That's what I'm going to. I don't know really what a pre-antibiotic is, but it may be a probiotic that's
Okay.
added to the food in some form or fashion to try to inoculate the bird with good bacteria to help. So the first, looking at it, she has 3 birds out of 7 that are that there is a possibility that they suspect avian chlamydiosis. Okay, now avian chlamydiosis is a zoonotic disease. I think I've mentioned on this that I've actually had psittacosis from a study that I was doing with little cockatiels on a, believe it or not, probiotic. How about that? Planets align. There's a probiotic study on little cockatiels that were young, and they were we needed to do it quickly because little cockatiels grow very, very fast. So it's hard to measure any effect on growth rate after a certain period of time. So the birds had avian chlamydiosis, and I got it. So it's always important to remember that this is a zoonotic disease. So if you do have birds that are suspected to have it, that make sure that you, since you're used to wearing a mask, is to wear a mask around the birds at this point, because you can inhale that through droppings, or if the birds have any type of sneezing, they sneeze, or through and so it gets into your respiratory system through your nasal mucosa. That's how it's transmitted. But keeping that in mind, because I think that's important, Laura, for everybody to remember, and on that. There's very few cases within the United States every year, but it is still something that everybody with birds should be aware of. Now, the one thing that you look at with avian chlamydiosis, that these birds is that with avian chlamydiosis, that if they are showing signs of disease, usually the eyes are reddened, and that's around the eyes. So we call that the conjunctiva, and it's reddened and maybe protruding. They could have nasal discharge. They could have respiratory discharge, and they can also have sometimes a kind of a lime green diarrhea or stool that is caused by the biliverdin, that due to the liver, because this organism really likes the liver and spleen. So those are some of the clinical signs. I don't really know what the clinical signs, what actually led to the diagnosis, but those are the clinical signs that are usually involved with it. One of the good diagnostic tests that you can try to use if the birds are showing or sick and it's suspected is the complete blood count, because it gets really high. The complete blood count gets really high. Let's just say normal's 15,000 white blood cells.
Mhm.
Well, it can get up into 80, 50, 100, over 100,000 white blood cells. So this is an indication of it. But there are some really good tests to try to identify and get a definitive diagnosis. And usually it's a panel. It's a panel of tests. And one of the tests is a combined culture of the eye, the choana, the respiratory, and the cloaca, looking using PCR, DNA testing to actually identify the pathogen. Blood, they can take the blood from the bird, and then they can look for the organism in the blood. And of course, if it's showing signs, then this is when you're going to see it. And if it's showing disease signs and you don't pick it up, then it kind of puts it into the area where it's going to be unlikely that that's what is the problem. It doesn't totally mean that it's a negative for avian chlamydiosis, but you have these multiple tests, this panel that looks for it. So that's one thing that you can do. The treatment of choice is doxycycline. So you're on the right medication. And I mean, doxycycline knocks it out. I mean, it is very effective. This organism lives in the cell. It's a bacteria, but it's an intracellular bacteria. So it goes into the cells to make more of the organism. And then the cell, it ruptures the cell, and all of these little elementary bodies or infectious forms of this go out and spread. And so what doxycycline does is it can get into the cell, is why it's so effective. When I had it and psittacosis, and they gave me tetracycline, within 3 hours, I went from like, I don't want to move, to I thought I could do backflips. I mean, it's that effective on this organism. So you're doing everything. If you suspect it, it's a zoonotic disease. So it's one thing that you would like to try to get a definitive diagnosis on, because if you could do the test, or if you have done the test to try to identify it, we use the University of Georgia Infectious Disease Lab out of Athens, Georgia. And if you can get this, say, yeah, this is definitely it, because doxycycline is a very good drug. And avian chlamydiosis, the clinical signs are really non-specific. I mean, the birds are sick, but they could be sick from a number of other conditions. And so if it's suspected, it would be really advantageous to try to get this panel to identify it, so you could say, yes, it is, and I have to really make sure, take precautions as I am, because I don't know now, cleaning the cages, wearing a mask, making sure your other birds aren't exposed. And if it isn't, then at least you don't have to be concerned about that. So hopefully this is somewhat helpful with that information.
Yeah, and I have just a few more updates on that. So the birds are an Amazon, a Senegal, and a lovebird. And you're right, it was a probiotic. So they sent out the fecal samples, and their white blood count is high. So that was the update.
Yeah. So, and high, like I said, high is, you have, the definition is variable on high. For avian chlamydiosis, usually a high blood count is over 50,000. Over 50,000. Just a normal bacterial, normal bacterial infections can go anywhere from 20 to 35,000, depending on what they are. We always say with pet birds and parrots, there are, outside of cancer, like leukemias, they can cause a very high white blood cell count. Outside of that, there's 3 really infectious diseases that cause significant high white blood cell counts. And avian chlamydiosis is one. And when we're saying high, I'm talking over 50,000 and up sometimes over 100. And we have had birds with avian mycobacteriosis or avian TB. We had an eagle one time that had a 350,000 white count, 350,000, which is a little over 15,000. And then also the other is something that most everybody's familiar with, aspergillosis. Aspergillosis can cause a white blood cell count over that 50,000. And of course, I would like to say that these diseases make it easy for us. They make it easy that everyone acts the same. And so every time you have an aspergillosis case, that it's over 50,000, and we can say, I think this African gray has aspergillosis. And of course, they don't. They make it difficult. Sometimes they can have aspergillosis and have a white blood cell count that's normal, or they can have TB and it's kind of within normal range. So the body responding to the organism is a little different. That is more the exception than the rule, because these organisms cause a lot of inflammation. They cause a lot of inflammation, and this inflammation is what raises your white blood cell. The white blood cells are going to try to reduce that. Yeah.
All right. Melanie had a question about what to feed eclectus parrots. So, she's like, we've heard good and bad things about a pellet diet for eclectus specifically. What are your thoughts on pellets and pelleted diet and eclectus parrots?
Well, I think that is, she's done well, because I think anything that, you're looking at diet, you're going to be having, seeing good things and bad things, whether it's an eclectus, cockatoos, toucans, whatever, captive diets, as far as, birds that's not in their natural setting, and you're providing a diet to try to really replicate what they normally eat and their normal nutrition. There's going to be debate. And that's why, as I've mentioned and have mentioned, and this is good to continue to bring up, because there's a lot of people, as with just about anything, that have strong convictions, and they said, this is the way I've been doing it, I've been successful, and that's something to definitely consider. But there's been people that have maintained birds for many years on a diet that's probably just not the best, that they can. And what you're looking at is just because the bird is living doesn't mean it's optimum. If you it's optimum psychologically and it's optimum health wise. Okay, there's people that can just exist, but are they really, getting the most out of life just because they're alive? And this goes to something like with Dr. Pepperberg in her case with Alex the African Gray, when she says and I'm just kind of paraphrasing everything that a lot of the things that she's worked on over the years, but it's like Alex was one bird, and she said it's not like every bird is Alex.
Yeah.
But what she kind of her work has shown, and I believe what she obtained from that work is that if you work with the birds, that there can be influence on working with the birds to actually get them to reach their potential, whatever that is, in their interaction, in their activity, in their intelligence, as they are a companion bird. So you go like, well, gosh, you went off on Irene Pepperberg and behavior, and we're talking about nutrition. Well, this is kind of where we are with the eclectus parrots, or any of the other birds. If you could provide them the best nutritional offerings that you can, and I always feel like a diversified diet helps them nutritionally and also psychologically, that is the best for the bird. Now, not everybody can do that, but if you go toward that would be your best bet. If you can't do it, do the best you can and try to provide that, knowing that there are other things that can enhance their diet and possibly their life, if that makes sense. So it's not like, well, all right, pelleted diets are bad. Well, if pelleted diets are there, what they are doing is providing a source. If that bird eats it, that they're getting vitamins, minerals, and nutrients that are finite. That they're getting that, and it's really something that provides it across the board. Vitamins and minerals across the board, and also other protein, what have you. Whereas when you have self-selection in eating, and somebody changes a diet every day, and the bird is self-selecting only those every day, that's all they're eating. So there you go. I would say the pelleted diet, if you could do it, and part of a diversified diet, then that would be optimum.
Okay. Again, we had a question from Marco. What are the best tests to perform in a general animal hospital for the diagnosis of chlamydia, PBFD, polyomavirus, and bornavirus in parrots? Is there a one-stop shop test for all of that, or capture all those?
Well, it is. What was the first one?
Okay. Chlamydia.
Okay, we'll go one at a time. Well, the chlamydia, there's different labs and whatever, and I always mention to veterinarians that as far as a diagnostic lab is concerned, to use the same diagnostic lab that you trust and that you believe will provide the best information that is possible, and that are knowledgeable, and that you can that are informative, and that you can communicate with if you have any questions. Because the veterinarian is me. If I'm talking to a diagnostic lab, I know what my patient is, and I'm submitting these tests in general, because I believe that the bird may have this disease condition, and I'm trying to confirm it. Okay, these avian chlamydiosis is very difficult to detect if it's subclinical, meaning the bird is showing no clinical signs and appears to be healthy. It's not something that you can just, there is a possibility that you could get serology and look for antibody levels, but that is not always the case, because the bird may have been exposed at one time and has developed natural antibodies, but doesn't have the infection. So there's some issues as far as reading the test and understanding what the results mean. And so that's part of interpretation of the results, understanding the bird and also understanding the disease process as it occurs within that bird. The panel and avian chlamydiosis is again best if you suspect it due to clinical signs, and say, oh, this looks like avian chlamydiosis. Oh, look at this white blood cell count high. We got to test for it. That's when your best chance, if it is in fact avian chlamydiosis, you'll get it. That test is it is a panel that, as I mentioned, is the combined culture looking for the organism through PCR, blood, whole blood looking for the organism, and then also serology, looking at antibody levels. And they'll look at early antibodies and also later antibodies from the bird. Now, the next was what, Laura? What was the next?
So we had the big ones, PBFD, polyomavirus,
PBFD,
coronavirus.
cytosine beacon feather disease. That's a very good one. The diagnostic test is PCR through blood. And that is a good test just to try to, because the birds can have this disease, and there is a blood test to look for the PCR, look for the organism in the blood using PCR DNA testing. Now, the one thing about that is that if it's positive, we don't say, oh, the bird has it, unless we see feathers or any clinical signs of it. Just screening the birds, and the birds are normal, we usually recommend to isolate those birds and retest for a year or so, about a 6-month intervals, to see if the bird clears the virus. That's a possibility, but want to do that. Now, you have polyomavirus. Polyomavirus is kind of an intermittent shedder. So this is a blood test of, again, and I want to kind of go back. I want to rewind and the cytosine beacon feather disease. You can also, if you have clinical signs of the disease, you can take feather follicle biopsies, and that will also identify the virus in that. Now we go fast forward to polyomavirus. That is a virus that, if it's an older bird, it's somewhat difficult because there's intermittent shedding, and so you don't have a high population. a virus to detect, but you can use a blood test for that. Now, it's a very good test if you have birds dying or a bird that comes in that you suspect polyoma virus. It's a very good test, and also culture. Swab. You can use the swabs for that too, for PCR, similar to what we talked about. No serology like avian chlamydiosis, but swabs looking for shedding, and then also blood. And then Bornavirus is, I think, a blood PCR on that, and then looking at the bird and what you're looking for. Again, if it's positive, what does that mean? If there's no clinical signs. So we're still trying to figure that one out.
All right. So Kim in Southern California, shout out. I'm also in Southern California.
There you go.
My neighbor. There's a yellow-naped Amazon and wants to know, how often should I be giving her showers? Because we don't get much rain in these parts, so
Yeah, that's right. Again, I mean, once a day, it wouldn't be too much as far as I'm concerned. It's just that would, I think that's good if she likes them. Then I would say that is a great psychological benefit for the bird. So if she's given them once a day, I wouldn't say that's too much. I don't think you need to keep the bird wet all the time. But
I was going to ask, is there like too much frequency of showers and rain and stuff on your birds?
Can
you overbathe or overshower your bird, especially if they come from like a rainforest habitat? Is there?
Yeah, I think you can. I think it gets to be water torture after certain. There's a point of diminishing return. Like, whoa, waterboarding. Yeah. But again, I think that once a day, and I've had owners shower with their birds. They'd have a perch in the shower, and I think that from what I'm to understand, the bird enjoys that. So I don't think once a day is too much, but I think that would be it. A lot of times people will recognize their birds. They kind of dictate when they want to do it. My little Senegal, I would say it's kind of once a week, because kind of the next thing I know, he's got a wet little rat, but he may do it more while I'm here talking at a webinar. He may be taking and he's all nice and dry when I get home. So, but I can tell how much water's been used, and if it's rained on the floor around there.
Some birds have individual preferences too. Individual birds, and
but if I take them outside and it's nice, I'll get the spray out and get them all
all rained out.
Shower on that.
All right. Hey, so then we have a question from a viewer in Japan.
And where?
From Japan.
Okay.
Welcome. Wants to know about gray parrots. They have a lifespan of about 50 years, but are there many older gray parrots in the US? They want to know the difference of lifespan between grays in captivity and grays in the wild. So do you have any info on that?
No. What I can kind of answer that question in kind of my personal observations, And when you look at lifespan, because we all may have just learned about the lady in Japan that just passed away, that was 119 years old, and passed the torch to the lady in France who's 118 years old. Now, so what is the average life expectancy of a medium parrot, say an Amazon or a African gray? And I would say, based on personal observation, over a few years, 30 to 40 years. That's the average. So we can say 35 if we want to even get right in the middle. Now, does that mean, so that's just like in your country, or in the US, the average life expectancy of a male is about 79 years old, and a female about 80 to 81 years old. Okay, that's the average. Now, as I say, people live longer, thank goodness, right? But the average, so if we say the average for an African gray is 35 years, based on patients that I've had and birds that we've seen, and we still, we have a number of 30 to 40-year-old African grays and Amazons. Very few 40-year-old Amazons and African gray. If we do get it in, and so if we do have birds, that come in that are over 40, often they're in pretty poor shape. And all of these birds have old age diseases, cardiovascular disease, lens opacities. So it's like, they're not like, oh, well, they're only 30 years old, they got 30 more years to live. No, that's not what the body's telling me. They got cataracts, they got cardiovascular disease, and some of these have been on very good diets and nutrition. So that's, we have a number of we have a lot of 30 to 40-year-old patients, but they're older, and very few 40-year-old patients. And of course, we have our 118, 119-year-old kind of human that come in, that people say, I've had them for 50, and I can't deny that. But just like there's how many 118, 119-year-old humans are out there? Not many. Or 100-year-old, but there are people out there. And so you have older parrots that can live that long, but that's not the average. And on that. So was there something else on there? There was some other question on that. At the
do we, are there many older grays in the US? Like, are we seeing a trend of longevity?
I mean, I know what the question was. I know now, Laura. We're seeing parrots live longer. Medicine had, and the main thing is nutrition and care and understanding of how to care for these birds. We are seeing the parrots live longer. Yes, by all means we are. And in captivity, I don't have any really any hard scientific proof of this, but I'd bet the house that they live much longer in captivity than in the wild, because it's a tough place out there, and survival of the fittest. And if you aren't as fast as you were when you were 18 years old, then you aren't going to get away. So yes, so I would say, hands down, my opinion, they live much longer in captivity than in the wild.
Wow. Okay, there you have it. Let's see here. So that went by quick. That was a breezy hour of info that you gave us. It flew right by. So we'll have to show.
Already?
It's
It
already.
must go faster in California.
It does, right? No.
Well, it's slow down here in Louisiana.
Yeah, you guys take minutes. We got freeway traffic to deal with, so we're always in the. But I wanted to once again thank you for your time. If we didn't get to your question today, well, we have it. If you put it in the Q&A button feature, we can capture it and send you an answer. And someone had a great question that if we don't get to someone's question today, this is from Danielle. Is there a way to get it out to the other people that are on this webinar? So we'll find that out. I have no idea about that so far, but we'll find that out for you. Dr. Tully, thank you. And I'm going to announce today's winner of our product giveaway, and that is going out to Pat Maraska. I hope I said that right. Congratulations. You're going to get a package. What are you getting? You are getting, I think it's the garden veggie Nutriberries. It looks delightful. It looks healthy. And also another product of your bird's choice. And real quick, we're also going to get, I want to give a sneak preview of what we have going on for next Friday's webinar. Believe it or not, it's May already, May 6th. We're going to have Ann Brooks. She's the co-founder and president of the Phoenix Landing Foundation. And she is going to give us just going to go over and setting the cage up for action. So I like this topic a lot. It's how to set your bird's cage up or home to kind of encourage movement and activity. So kind of get them from not being so much perch potatoes prep. So I'm looking forward to hearing that. And then Dr. Tully, I'm sure we'll see you back in May. So
yeah, I think so. I don't know what they have planned, but I know we have others coming up. So I don't know exactly when. And if they see me, they see you.
Oh yeah, that's right. Okay. Huh. Yeah, I'm not sure either. Okay, well, till next time. We'll have fabulous questions for you next time. These are all great. Every Friday, it's a pleasure to be on with you. And again, thank you for your time. In your precious Friday time. Appreciate it.
Well, thank you, Laura. Thank you, Nina, for standing in for Brenda. Did a fantastic job.
Yes, props to Nina for standing for Brenda today.
And most of all, thank all of our attendees to the webinar with those fantastic questions, and look forward to next time, Laura.
All right. Until then, everyone have a fabulous weekend. All the best to you and your flock, and stay safe.
All right. Take care. Bye.